we can't treat strokes. So you diagnose the stroke and you rule out a hemorrhagic CVA, and then you're like, okay, well, here's some aspirin and Lipitor, and sorry, you know. Antibiotics, everybody gets Rocephin. Everybody gets Rocephin. When they go to the floor, maybe they'll get Vanco, maybe they'll get meropenem, but other than that, limited supply of antibiotics. And there's so much antibiotic resistance.
Wow.
So most of the time you're giving antibiotics. I saw a patient had a urine culture and it was literally resistant to almost everything, even meropenem. And and mind you, these patients, you know, I see them in the ER, but sometimes I'll follow up in the ICU to see how they're doing. They all develop secondary infections. Every single patient develops an infection. So many patients get intubated, extubated, re-intubated, extubated, re-intubated, ARDS, ventilator-associated pneumonia. The tubing on the vents, the tubing that they use, that's supposed to be disposable. Those have not been switched out since the beginning of the war.
Wow.
It's
Wow.
the same tubing that every patient is on because that's all they have. When they on the ventilators, there's the attachment to humidify the oxygen. None of the ventilators have that. So it puts the patients at higher risk for ARDS, for ventilator-associated pneumonia. The other day we had to intubate a patient in status asthmaticus. And once we intubated him, I was like, cool, now that he's intubated, how are we going to give him nebs? None of the ventilators have the attachment to do inline nebulizers. So I called the ICU. They literally had to scramble to find one attachment that works on only one ventilator. So it's, you know, you get by, but there's going to come a point where like this one piece that we find for this one patient is not going to be available for the next patient.